Welcome to the Enlarged Prostate channel, your trusted source for everything related to men's health and prostate care. If you're new here, we're happy to have you. Our mission is to provide clear, science-backed information to help men make informed decisions about their health, especially when it comes to one of the most overlooked areas, the prostate. Today's video is all about a condition that affects millions of men worldwide, and one that becomes more common as we age: benign prostatic hyperplasia, also known as BPH or an enlarged prostate. Let's start with the basics. BPH is not cancer, and it doesn't increase your risk for prostate cancer, but it can significantly impact your quality of life. As men age, the prostate naturally grows. This growth, however, can press against the urethra, the tube that carries urine out of the body, and cause uncomfortable and frustrating urinary symptoms. These can include a weak urine stream, the constant feeling that you need to urinate, especially at night, and difficulty fully emptying the bladder. Statistically speaking, BPH is extremely common. Around 50 to 60% of men in their 60s deal with it. By the time they reach their 80s, up to 80% of men will experience symptoms related to an enlarged prostate. That means if you're noticing these signs, you're definitely not alone. The good news is that modern medicine is evolving, and we now have innovative, less invasive options that offer relief without the need for long-term medications or invasive surgeries. One of the most exciting advancements in recent years is a treatment called iTind. You might be wondering, what exactly is iTind, and how does it help? iTind is a minimally invasive procedure designed specifically for men dealing with urinary symptoms from BPH. Unlike traditional surgeries like TURP, which involve removing parts of the prostate or lifelong medication that may come with side effects, iTind offers a temporary implant that helps reshape the inside of the prostate without cutting or removing any tissue. Here's how it works. The iTind device is made of a flexible metal shaped like a small basket. It's inserted into the prostate using a telescopic camera, usually while the patient is under general anesthesia. This means there's no pain during the procedure, and it can often be done in an outpatient setting. Once in place, the device gently expands inside the prostate over the course of 5 to 7 days. During this time, it creates 3 channels inside the prostate tissue, relieving the pressure on the urethra and allowing urine to flow more freely. After a few days, the device is removed and there's nothing permanent left behind. This is one of the biggest advantages of iTind. Unlike other treatments that leave implants or require tissue removal, iTind uses the body's natural healing process to reshape the prostate gently and effectively. Most men report an improvement in their urine flow and a reduction in urgency, frequency, and nighttime trips to the bathroom. But how do we know it works? Clinical studies have shown that iTind provides a symptom improvement of around 45%. These improvements are measured using internationally recognized questionnaires completed by the patients themselves. Even more impressive, men also report a similar improvement in quality of life, showing how much better they feel in their daily routines after the treatment. And perhaps the most reassuring data, approximately 90% of men are still satisfied with their results up to 6 years after the procedure. That's real, lasting relief without major surgery. Let's talk about something that's important to many men: sexual health. One of the major concerns with traditional prostate surgeries is the risk of side effects related to sexual function, including erectile dysfunction or dry ejaculation. With iTind, this risk is extremely low. Because there's no cutting or burning and no permanent implants, most men maintain their normal sexual function after treatment, including both erections and ejaculation. Now, like any medical procedure, iTind isn't perfect. During the few days the device is in place, some men experience mild discomfort, blood in the urine, or increased urgency and frequency. There's also a small thread connected to the device that stays outside the body, which can be a bit annoying. But once the device is removed, usually on day 5 to 7, those symptoms tend to resolve quickly, and that's when many men start noticing the real benefits. In short, iTind offers a non-surgical outpatient treatment, no permanent implants, minimal risk of sexual side effects, fast recovery, and lasting results that have been proven in clinical studies. If you've been living with urinary problems or have been told you have an enlarged prostate, this could be the breakthrough you've been waiting for. Always talk to a qualified urology specialist to see if iTind is right for you, but knowing your options is the first step to reclaiming your quality of life. We'd love to hear your thoughts. Have you or someone you know experienced BPH? Have you heard of the iTind procedure before? Leave your questions, experiences, or concerns down in the comments section below. Your story might help another man who's going through the same thing. And if you found this video helpful, don't forget to like, share, and subscribe to the Saúde da Próstata channel. Your support helps us continue to bring important health information to more people. Take care of your health and above all, take care of your prostate. See you in the next video.